But we're going to talk today about the one and done. We're going to talk about the one visit, final smile. What is 99.9% precise in this world? The pig dental is. That's the answer.
It.
Someone's going to tell you, oh, PMMA, that's only a temporary material. And it's not only a temporary material. But when I push, I'm putting strain. You guys can see this. Can you see this?
Now with the scanner, we get the whole thing three-dimensionally. And we can add the scanner, pictures, and the actual intraoral scanning. And it's like we have the patient itself virtually on the computer, right? And not everybody's going to be able, we know that not everybody's going to be able to afford a zirconium, right? So dentistry itself had to look somewhere else to make it affordable.
We don't work with jealousy. We don't work with, oh, no. You know, we try to, if we see somebody has something that we need to get better on, we're going to go get it. We're going to go learn. We're going to go do whatever is the best option for you so you can have that supreme smile. Hello, welcome back to Supremedental Podcast Studio. You could be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, my name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. This podcast was meant for you, the patient. And today we have Dr. Elias.
Hello, Frank.
And we have Dr. Luis.
Hello, Frank.
Today we're going to talk about something very special that we've been working on for quite some time. But before that, don't forget that we're on Spotify. So look us up on Spotify, Supreme Dental Podcast Studio, so you can hear beautiful voices when you're driving down the freeway or when you're working out. I don't know why you would want to hear us when you're working out, but if that pumps you up, hey, we're all about it. But we're going to talk today about the one and done. We're going to talk about the one visit, final smile. We're going to talk about patients coming down, getting their extractions, their implants, and their final prosthesis in one visit. Guide me, guys.
Well, now with this promotion, the patient has the opportunity to have the work in only one time, only one visit. It's a wonderful solution. For example, the patients don't like come back in a couple times here. It's a good option for these patients. It's only one visit, maybe 1 week for everything. It's a good decision. The patient has the opportunity, for example, in the next time, to check if the patient need change any color, any size. The patient come back here to change the structure for a new one. Why? Because it's a PMMA. It's very, very easy to fix the problem or change for another zirconium or Cerpic. That, in my opinion, is a wonderful opportunity.
Yeah, as Dr. Luis mentioned, it's an opportunity for the patients, as you mentioned, for them to come down in one visit. We could do, on certain cases, selected cases, we could do extractions. If they need extractions, we can place the implants. And with the technology that we're going to have now, we're going to be able to do one stage, do it all.
Now, what exactly is PMMA? Like, why would I want this?
It's acrylic, but it's a stronger acrylic.
Okay.
It's not what is the name? Regular acrylic. To do that, for example, the full dentures. No, it's a different acrylic. It's a new technology.
It's been on the market for quite some time. PMMA. It's based on composite resin. It's sort of a thermoplastic as well, just for the patients to understand. I'm not going to get into big detail on it, but it works very well. It's biocompatible. We use it a lot in dentistry. There's certain grades to it on how much pressure they can be applied to before they break. There's PMMAs that are used for temporaries, and there's PMMAs that are used for final prosthesis.
That's exactly what I want to talk about. Actually, I want to talk about a couple things. So, for example, we offer immediate loads.
Yeah.
Okay, and the immediate load is made out of acrylic and acrylic teeth.
Right.
Yeah.
Because that is a throwaway. It's just for 4 to 6 months. Patients throw it away. It has no metal bar.
Yeah.
Now the metal acrylic It's a metal bar, and we'll post a picture video down here. It's a metal bar with acrylic gum and composite teeth.
Yeah.
So it's 3 different
Materials. Yeah.
in one. And what it's a common thing for this to happen is the front teeth. What is it, the front 6?
Yes.
Yeah.
The only thing that's grasping onto the tooth is grasping, the composite tooth is only grabbing onto the acrylic.
Yeah.
It's not grabbing onto the metal. So when pressure is, when you eat something that you shouldn't, or you bite too hard, or whatever it is,
Yeah.
well, normally it's when you bite something that you shouldn't, but it doesn't break, but a tooth pops out.
It's for depression.
And that is a common issue, not at Supreme, but worldwide. Actually, I was doing my research, and you guys have done your research, that some of the top dentists in the world do not want to do metal acrylic because of, they know that it's not because of their work, but because of anything that happens afterwards. The patient will then come back and will say, you did this work wrong.
Right.
You, Luis, did not take the impression, or the lab messed up, because they don't understand that it is a new smile. It is new teeth, and you could eat a lot of things, but there's certain things that you cannot eat. There's a certain rules of things that you may do and may not do. Okay. So then obviously we looked through the lab. We talked about how we can do this better. We've done it better from when we started back in the day.
Yeah.
But it's still 3 different materials.
Right. And I think dental materials have evolved over the years.
Mm-hmm.
Before, there was only metal acrylic. We weren't evolved enough in zirconium or other materials, so the only thing that we could offer any dentist in the world was implants over a metal bar with acrylic teeth.
And that was the best, because that's all there was.
That's all there was, yeah.
And that gave you the solution of giving you teeth again when you didn't have teeth anymore.
Right.
So obviously that was the best solution.
But complications started coming up, which was the teeth popping out, so we had to look somewhere else, and there was research done, this, that, and the other, and it turned out to be zirconium, and then it turned out to be the Zerpic. But things that we have to put on a balance, right? It's what material suits the patient best.
Right.
Because it's not like just everything for one patient, and it's just like you go buy.
A one size fits all.
No, that's correct. Yeah. So we try to look for the best material for the patients, but we also have to be sure that the economics of the patients, they can afford that.
Yeah, I can go in the dealership and they could tell me the best car for me is a Lambo.
Oh, yeah.
But if I only got $50,000, that's not going to cut it.
Right. And not everybody's going to be able, we know that not everybody's going to be able to afford a zirconium, right? So dentistry itself had to look somewhere else to make it affordable for all the patients. We knew that metal acrylic, that was the standard back in the day, but now we've come up with different materials that are not as expensive as zirconium and can work way better than metal acrylic, and that's the direction that we're taking now. Because as you mentioned, some doctors around the world, they only do zirconium and that's it. And you can't afford it, well, I'm sorry. And we don't want to do that, right?
No.
We want to make sure that all the patients that come in with us have a permanent solution, and we're always looking for a way.
Options are very important.
Welcome to Dental Facts. Did you know smiling helps you live longer? Every time you smile, your body produces greater amount of antibodies, giving you an immunity boost. You heard it first at Supremedental podcast. Floss, brush, and keep smiling.
You talked about PMMA, and this came as one of the questions because obviously you guys know we have different agents, we work with different agencies, and one of the question was, but I've heard PMMA breaks easily. I heard PMMA is only like a throwaway. It's a temporary material.
Right.
And you said that PMMAs, there's temporary materials and then there's other solutions of PMMA. Can you guys talk a little bit more about that? So, because what's going to happen is you guys back at home, someone's going to tell you, once you guys let them know about the one and done, about the PMMA, someone's going to tell you, oh, PMMA, that's only a temporary material, and it's not only a temporary material. Or they're going to tell you, it cannot be done. You cannot come down and get in extractions and get the final one. And we're going to go into a little bit more about that because I want to first answer the other question. Tell me about the PMMA. You said it was temporary, and then tell me about the one that's not temporary. What's the difference?
Even with zirconium or any dental materials, there's different grades of the same material, but how much of it is actually composed of, right? There's zirconium that's only going to be able to resist a certain amount of pressure, but then there's other grade of zirconium that's harder. Same thing with the PMMAs. There's a certain PMMA that can sustain a certain amount of pressure.
Yeah.
And there's better PMMAs that are done differently of how they're composed chemically to last longer.
And the only PMMA that we're working with is Ivoclar, which is a top end PMMA, correct?
Yeah,
That's
correct.
correct.
Okay. That's correct.
Can you zoom that camera real quick to me? So this is a PMMA, okay? And then he'll probably post a picture down here. But we're doing it. This is a solid PMMA, so it's completely solid inside. There's no metal structure to it.
No.
The guy from the lab told me that I couldn't break it. Now, I don't want to apply all my strength and try to break it because I consider myself a little bit on top of the strength-wise, a little bit stronger than a 12-year-old little girl. But when I push, I'm putting strain. You guys can see this. Can you see this? Look at my fingers. I'm putting pressure. And everything's still one piece.
Yeah.
I'm putting the pressure that it would normally be put. Because if I go like this, I don't know, I might break it if I put a lot of strength into it. But your bite's never going to do this. Okay?
Never.
So we got to be smart about it. So now this is my strong arm. I'm going to put pressure on it, on the tooth itself. And you guys could see how it's dipping into my fingers. And I'm putting pressure. And I'm putting pressure. And I'm putting pressure. And it's not breaking. It's still there.
It's one solid piece.
It's
one solid piece.
Yep.
It is not just a throwaway. This is something. No T-base. That's
T-base.
another thing. There's going to be no T-base. What does that mean? That normally there's a cylinder.
Yeah.
That is put inside of these puppies right here. And in the cylinder gets glued on or cemented on these. And then that can come loose. And then this will come loose.
Right.
And we are not using that. We're using a screw that to avoid the T-base.
Yeah.
And now we're able just to be just one solid piece.
Correct.
Yep.
So we're handling, in easier terms, we're controlling the controllables. We're trying to take away all the errors that might happen in the future and correct them from the beginning, so you don't have to come back. But this is strong. This is the first time. Look, I'm not. He already zoomed out, but can you zoom back in? Can you zoom it back in? Look at my finger. Look at this right here. Look at my finger. That's where the tooth was that I was putting pressure in. That tooth dipped into my skin. And there's the mark to show you guys that I wasn't just, I'm not that good of an actor. So there it is. Okay? It felt like I just got bitten by something just out of something. But so you guys our patients are going to be told, and you guys are going to be told back at home. You guys are going to be told, hey, this is not going to work out. This cannot be done. You cannot get this done in one time. Why can't we do it? Why are we able to do these things in a 1 week span?
For example, now with the next technology is coming next week, the PIC cam, the CT scan, we have the opportunity to take the original dimension of the patients. But it's necessary a special marker screw or the PIC cam. When the doctors can keep it the original dimension, we have the control of the bite. Because, for example, when the doctors don't have the original dimension, is when the patients can break the dentures, can move the jaw in a incorrect position. But with this technology, we have the control of the original dimension of the patient. Now with this, then new denture one and done, we have a relax bite, original bite, but now with another material, PMMA.
So you have a passive bite. Everything is
Yes,
divided into
yes.
all the implants perfectly.
Right.
Yeah.
What do you have to say about that?
I believe it's not that I believe, right? That's what, I was going to tell you that it's not like we're making this up,
Okay.
right? There's studies out there. It's not like we're just basing off our experience, but we're basing off of studies that have been done,
Yeah.
research that this is possible, because this happened to us with immediate loading. People that don't do immediate loading, oh, you shouldn't immediately load these implants. Implants have been immediately loaded for more than 20 years.
Okay. So it's not something that we just invented.
No.
Wow.
I'm sorry.
Yeah.
Breathtaking, guys. Keep on going. Keep on hitting me.
But it does take for the surgeon and for whoever is doing the teeth
Yeah.
a lot more experience
Okay.
and a lot more training for sure. So that's why a lot of people don't want to do them. But as we've seen with research and we've seen here at the clinic, the implants do a whole lot better. They heal faster. There's less bone. You lose less bone. You lose less gum as well.
Because the bone is stimulation, correct?
Yes,
It
correct.
stimulates your bone.
Yeah. The cells.
And
The
then
bone cell.
yeah, there you go, the bone cells. And so then the threads, and we able to see in the X-rays how the threads, when they leave
Yeah.
with an immediate load, they come back and they're almost, less than a 5% bone loss against anywhere from 15 up to 30%, because we could see 2 to 3 threads sometimes when they come back with the normal.
We have to do less
Conventional
surgery
denture.
because with the conventional denture, we have to open the gums again. You know, the
Yeah.
bone is hurt again, the gum is hurt again, and with immediately loading, we just do it at one time. And with the materials that we have, the technology that we have, everything's going to be much more precise.
Now you talked about that we're gonna have a new CAT scan. Now the CAT scan is the 9600 from Carestream, which has been 5 years in a row the top in the world of its class. It also has a facial recognition,
And facial scanner as well.
facial
Yeah,
scanner,
facial
not
scanner,
facial
yeah.
recognition, facial scanner. That helps you guys. How does that help you guys? The facial scanner.
I think I've been mentioning this a lot.
Okay.
The facial generated dental treatment,
Yeah.
You say that your face dictates your teeth.
where the
The
teeth
size.
should be.
Yeah.
Size,
For example,
shape,
size, the color.
everything.
Yeah.
So your mouth does not dictate. Your mouth dictates what the area that you have to work with in your mouth.
That is correct.
Yeah.
And your face dictates the shape,
The size.
the size
size.
to make it look natural. Because we all seen that lady or that man crossing the street with the teeth that you're like, those teeth are fake, because you know right away that they were not in that face.
Right.
They're not meant to be in that mouth. And this is what fixes that.
Yeah, the
Yeah.
facial generated dental treatment, where the 2 teeth in the front should be, how the length of the teeth, the size of the teeth, the shape of the teeth.
Yeah.
And if we have the scanner of
The
because
color gum.
before we used to do it
Yeah.
with pictures, right?
Okay,
But it's
yeah.
only 2 dimensions. Now with the scanner, we get the whole thing
Yeah.
3-dimensionally, and we can add the scanner, pictures, and the actual intraoral scanning. And it's like we have the patient itself
Yeah.
virtually on the computer. It's like we're working on you, but completely digitally.
So we're not saying that dentists can be replaced by computers. But with this new technology, it helps a whole lot.
It's information that we capture that
Yeah.
that leads us to make better decisions.
Okay.
Yeah.
So you're using, obviously, technology to an advantage.
Yeah.
Another very, very important
Yes.
thing is the position of the lips. With this
The
facial
lips,
scan,
okay.
we have the position of the lips.
Your position.
It's a very important thing for the cosmetic.
Yeah, because a lot of times patients, after working for a while, they don't even know. Then they're shaking because their
Yeah.
mouth had been open for quite some time. And with this, from the beginning, you already got it,
Yes.
Yeah. Yes.
and you're able. So now tell me how the pig dental is going to help. Now the pig dental, once again, and we'll put another picture and video down here, George. You got a lot of pictures and videos to put. It is something that the little flags get on top of your implants, and we take the impression. It's the only impression in the world to this day. I don't know tomorrow, but to this day, that is 99.9% precise.
That is
The
correct.
precision.
Okay, and that gives us the best passive solution. So the distribution of the strength of the bite, it is passive and it's perfect. 99.9%. What is 99.9% precise in this world? The pig dental is. That's the
And that's
answer.
it.
That's the answer.
Yeah.
The pig dental, and probably the love of Luis not spending money. I think that's 100%. But just to let you guys know, we're gonna go. Well, I don't know if my wife and I are still gonna go. We're still up in grabs on that. But I know that 3 of you guys are going to Singapore. Dr. Alonso, Dr. Elias, and Dr. Luis. But I know that now Little Bird told me that George, our videographer, is also going to Singapore with you guys to document you guys step by step.
The experience.
What is the experience like?
Yeah.
What is it like to fly those? Well, you guys are flying 12 to 13 hours to Tokyo first. You guys are doing a pit stop at Tokyo.
Yeah, he's not just going to Singapore. He's also going to Tokyo.
Yeah.
and then after that, from Tokyo, you guys are going to Singapore.
Yes.
And you guys are going to see more reels, obviously, from over there when that happens. And that'll be sometime in May, June. But also he's able to document you guys so patients can see what it's like. Because patients hear about this technology, perhaps think everybody have this technology. Man, everybody must have a pig dental. Everybody must have the new CareStream. Nobody in Algodones, and this is a lot of dental clinics, is working with that new CareStream, with the new CAT scan. The pig dental, there is other places that have it, or perhaps like 2 places.
As far as the dental places, only one.
And what I have noticed is that the little flags inside their mouth used to be bigger.
Yes.
And now the new ones that we got are very tiny, because that's the new generation. After I don't know how many years of that, the main one being active, this one just came out last December, and we waited like 6 to 8 months to get it. We put in the last January, we placed the order, and we barely got it this past November, and we're barely taking the training this upcoming week. So that's gonna be everything a lot easier for the not to have their mouth open so wide, and be able to work with them a little bit better. So you're going to Singapore, and you know what's funny thing, and real quick, guys, real funny thing is that these guys are traveling on an airline that I've never even heard of. And I'm not going to mention the airlines because I don't want to hurt any feelings. I believe that Dr. Luis, Elias, and Alonso don't even have a chair. I think that they're standing like on a bus on the airplane, and George, on the takeoff, he's gonna be like 2-3 hours in a different flight, but he is flying. He is gonna have a chair. He's gonna have a sofa seat. He might even have water. It's only a 12-13 hour trip. Who cares if you go thirsty? And so yeah, just to let you guys know, these guys are gonna be very specific in your mouth, and a lot of the patients that have already been here with us have experienced that they will work on something. And not always do you spend more money. A lot of the times you save money. And the patients that know about this know that a lot of the times they'll be like, well, for example, Dr. Luis, he was going to do some immediate loads on a patient. But during the surgery, Dr. Elias seen that the patient, the best bet was not having immediate loads. So instead of us charging the immediate load and be like, whoops, I don't know what happened, it didn't work out, we're like, you know what, we have to refund that, because while we were there, we changed our mind for the best for the patient, not the best for the clinic or for you guys. You guys are not getting paid for that. I'm not getting paid for that.
It's for the patients.
It's for the patient itself.
Yeah.
So Dr. Luis is also a penny pincher for you guys, not just for his airfare. And just to let you guys know, he's taking burritos. So he eats that all throughout that week, so he doesn't have to spend money in restaurants.
Smart.
So
yeah, we're gonna make the best decision for the patient. Always. Even if it's a surgical thing that we're during the surgery, if something changes, we're not gonna, we're gonna do whatever's best. The advantage here is that Dr. Luis was doing the surgery. He thought of something, and the advantage is that it's several of us that do the same type of work, and we can all brainstorm and we can make the right decision at the right moment. And we always want the best. We always want the best for our patient, as you mentioned.
For the patient, yeah.
And that's something I think a little more private, but it's true that we don't get pressured from the clinic to do things that we shouldn't do. We only get what we want and to do the best. So we feel very comfortable working here with you that you always want the best for the patient, and it doesn't matter if it's economical, if we're going to take a hit or not, that we're going to make the right decision and we're going to make what's best for the patient.
We will never do something just for the money, because I've said this is a medical business. And when the business takes over the medical portion, it just becomes a business. And I said this thousands of times. Before we jumped on this podcast, I said, if something is not able to be done, because we're going to get hit on this by patients, by other clinics that don't do this, like they shouldn't be doing this. This doesn't work. You know, they should not be putting something over an implant. Guys, we're not making it up. Yeah. People are doing this, like top dentists in the world. Like there's studies on this. Now, if somebody doesn't want to look at those studies and someone doesn't want to stay updated and someone doesn't invest in new technologies and in new trainings for new techniques, that is none of our problem. And that should not be a problem for the patient either. The patient should go wherever they feel is the best solution for them. And we will not take any shortcuts.
Of course,
And we have not made Supreme what it is today because we take shortcuts. We're doing it because we do what's right and we stay as transparent as possible. And our patients can tell you this. When they come down, they're like, hey, I brought you this person. I brought you this patient. You know, I just had a patient while we were in the waiting room that told me this week, hey, remember me? And sometimes I don't remember because I've seen many patients throughout our 16 years of being here. And they said, hey, remember me? You told me a while back not to extract all my teeth. And look at them now. They're still there. They're still beautiful. While she was told in other places, she was told in the U.S., and then she brought that concept over to Mexico. I need to extract everything. And whatever clinic she decided to go to before us were order takers. And we're going to do whatever she was telling them to do just to make that money. Yeah. And that was not the right thing to do. Not always is the right path the easiest. But we believe it's the best, and we're going to continue to do so. So thank you so much for being here, you guys. This is something that is going to change the world to many patients, because a lot of patients come in and they don't want the acrylic. Now, if for any reason, now you have the PMMAs in your mouth, right? You walked out after a week, you got these beautiful guys in your mouth, but you're like, I really wanted zirconia. Well, then you can come back. You know, after a year, year and a half, 2 years, whenever you're ready, you can come back and get zirconias. There's no problem. But these guys are gonna, they're strong. The tooth they're not gonna pop out or pop off. I'm sorry, and it's a great solution. It's a great solution. A lot of patients don't want to come back, and if for any reason patients might be asking themselves, and I should have answered this a little bit sooner. What if my gums recede? Well, we're doing different techniques, to get closer to the bone itself, but still the gum might recede, and if it does happen and you have to come back, then we will take this guy off and we will add a little bit of gum to it, and then it's fixed. And that's it. That's the worst that it could happen. So besides that, this is great. I'm really excited about this. Really, really excited. Obviously, like I said before, for the first time, I feel that we have a lot of technology and we have a lot of talent. And for the first time, we're linking them. We have great things coming up this upcoming week. We have the new CAT scan coming in. We have the best CAT scan coming in. We have the best impression over implant, the PIC Dental, coming in. Yeah. We have the owner, the founder, the creator of the PIC Dental coming in, which he will be at the podcast also. And we're getting all this training. And then you just telling me about some other training from another doctor that you guys respect a lot, and that you believe he's probably the best dentist in Mexico, that he's gonna train us also on different things. So guys, we don't work with jealousy. We don't work with, oh no, we try to live. If we see somebody has something that we need to get better on, we're gonna go get it. We're gonna go learn. We're gonna go do whatever is the best option for you, so you can have that supreme smile. Yeah. But thank you so much, guys.
Thank you so much.
This has been Supreme Dental Podcast Studio, powered by Supreme Dental. Keep on smiling. Have a good one.
Thank you.